Of all the procedures I do, that's probably the most misunderstood procedure. I'll start off by saying the two most common reasons people don't have root canal done. Number one, someone will say to me, and I hear it every day, I had a root canal done and I still lost a tooth. Okay, and typically that means one of two things. The doctor told the patient that the patient needed to have the tooth restored, needed to have a filling opposed to crown or cap, and the patient never got around to doing it because maybe they didn't have the time, they didn't have the money. The second reason that people say that root canals are bad and evil is they'll say, I had a root canal and it hurt like heck. And typically what happens, those are people who wait too long, wait till Saturday night at midnight to come in when their face is swollen. When you have a lot of swelling and pus and infection around a tooth, it's tough to get the tooth numb. We have ways around that. We give antibiotics and let the infection resolve a little bit before we get in and do a root canal. If push comes to shove, I can get in there and I can do a root canal painlessly. We have some special types of Novocaine that can handle those situations that we use. So all things being said, root canals are really not that big a deal. They do work. They're very, very successful. Root canals are about 9 out of 10 root canals work fine with no problems. Every once in a while you get a tooth that the infection is just that deep-seated. A patient may not be able to handle an infection, much like someone who's more susceptible to cold. Sometimes you get people that the infections are harder to knock out even when a successful root canal is being done. But for the most part, they work fine. Our in-office experience doing root canals, we probably do a couple a day, so we're well versed in doing that. Our biggest problem with root canals from our standpoint is we find people fall asleep. There's no drilling involved. It's a very, very quiet procedure. So we have to talk loudly or turn up the TV or put cartoons on the TV or something to keep patients awake. Things get really bad. We have my assistant threaten to have me sing. But for the most part, the patients after they're done, I'd have to say across the board, they all say it wasn't all that bad. And they're glad that they got it behind them and were able to successfully complete the treatment.